Now we're going to talk about Frank's client factors, starting with his neurological deficits. Frank had a CVA, which Teresa discussed earlier. Because of his CVA, he now has impaired stereogenesis, which means he has an inability to recognize objects in his hand without looking at them. This impairment can be a safety hazard, which I will go more into in a bit. Frank also has left side neglect, which we watched a video on earlier. Some treatment options for this is mirror therapy and working with his affected side during functional activities. Next, we're going to talk about his muscle tone. Frank has decreased muscle tone in his trunk and affected upper extremity. To increase muscle tone in his trunk, we would have him sit at the edge of the bed with support for as long as he can and increase the time as we build up the muscle tone. With time, we will hopefully see him start to sit unsupported. To increase his upper extremity muscle tone, we would have him do some functional activities with his affected arm. We will most likely have to use hand-over-hand techniques when treating Frank. Using this technique, we can prepare simple meals like he would have before his CVA when his wife was out. We can also have him do some simple gardening by having him pot a plant. Having a plant in his room may also lift his spirits a bit during his stay. Now I want to show you a quick video on hand-over-hand techniques for meal preparation. Moving on to his cognition and perception. Frank has impaired safety awareness and poor judgment as a result of his CVA. To address this, we want to educate Frank and his wife on universal precautions and what to do if a dangerous situation presents itself. To do this, handouts would be a great reference for the both of them to have and look over, whether they're in the hospital or at home. During treatment, we can also give examples of safety hazards and ask Frank and his wife what they would do in that situation and correct them if needed. Frank also has impaired figure ground perception. This means he has a difficult time differentiating objects in a busy background. For safety measures, brightly colored tape can be used in and around his room and home upon discharge to help Frank differentiate between steps or furniture. Some functional activities we can do for Frank is to have him pick out certain clothes from a pile or his closet. Another activity for him to do while sitting at the edge of his bed is Frank also has impaired sensation to sharp, dull touch. Along with impaired stereogenesis, this can lead to many safety hazards. Because of Frank's favorite hobbies being woodwork and gardening, there is sure to be sharp tools around his house. Our intervention plan for this would be sensory re-education along with compensatory techniques. Some compensatory techniques would be using his unaffected limb to feel for what a tool is. Some psychological factors in Frank's life is his support system. Frank has a strong relationship with his wife, and it seems she is more than willing to assist Frank with his treatment. Educating and including his wife in the intervention plan will greatly benefit in Frank's recovery. Frank also has several friends that can help him out. He is friendly with his neighbors, so when he returns home, he may be able to ask them for help with some of his activities, such as gardening and home maintenance. He also has several friends that he keeps in touch with from his job at the post office. We would also recommend that Frank join a CVA support group. Sometimes clients may feel as if no one understands what they are going through. Joining a group of fellow CVA survivors may help Frank with his recovery process psychologically. Now we're going to talk about context and environment for Frank. Some concerns we have for Frank in regards to context and environment are as follows. I want to start with ambulation. Frank has had trouble when ambulating because he bumps into things when using his Hemi walker because of his unilateral neglect. We've discussed intervention options for this problem. Another problem we may run into is him catching or tripping on steps or carpet around his home. We can remove any carpet and place brightly colored tape on steps to prevent this from happening. Here I've also attached a video of how stroke patients can walk up and down stairs the easiest way after their CVA. Frank's awareness when it comes to safety, judgment, and attention can lead to him putting himself and others in dangerous situations, whether it be while he's preparing a meal and forgets to turn off the stove, or getting distracted while carving wood. He may find himself hurt or hurting others if this problem is not addressed. Patient education is a big part of Frank's treatment plan. Earlier, Teresa showed us a great video describing left side neglect and how Frank's vision may be affected. Vision affects every aspect of our life. Because of Frank's impaired perception, he may become confused when trying to find something, and his poor spatial relation may cause problems with mobility and other ADLs. Here I've attached a picture that shows how unilateral neglect may look from Frank's point of view. As discussed earlier, Frank has impaired sharp dull sensation, which can cause many problems because of his chosen hobbies. Here we have a great video on how to test for sharp dull sensation. Adaptations for Frank include home modifications. We've already discussed the brightly colored tape for steps and corners, but we can also move the furniture around his room and tell his wife to move the furniture around the home upon discharge so that Frank has more space while walking around the home. We have already seen some adaptive equipment Frank may be able to benefit from earlier, but I would like to reiterate a couple in regards to safety. Because of his impaired sensation, I would recommend a one-handed cutting board and rocker knife to decrease safety hazards. And for overall safety, when showering or toileting, grab bars should be installed. Frank already has a Hemi walker for ambulation. Earlier, I discussed Frank's support system. This includes his wife, his neighbors, and his friends. Frank also uses humor to cope with frustrations.